Good afternoon, and thank you for joining us for the launch of the Self-Care Matters resource. I would like to acknowledge the traditional owners of the land on which we meet and pay my respect to elders past, present and emerging. Palliative Care Australia is delighted to be involved in delivering this important and practical online tool to help healthcare workers improve their overall health and wellbeing by focusing on self-care. Self-care is more important than ever. When you take a moment for yourself to recenter your energies and to focus on emotional needs, you allow yourself to take better care of others afterwards. To say that the last 2 months have been stressful for healthcare workers is an understatement. The uncertainty generated by the COVID-19 pandemic has put a burden on all health systems and caused many of us to work even longer hours than usual. The risk of burnout and negative impacts to our mental health have increased, and it's easy to fall into a negative pattern. In the palliative care setting, personal protective equipment and physical distancing requirements mean that we cannot have the same level of connection with our patients. We are noticing the absence of the brief touch on the shoulder, the shaking hands of a patient, or hugging a grieving family member, all of which cannot happen at the moment. As carers, we need to acknowledge that the work we do can take a toll on us, and that we need to take time to care for ourselves and connect with our loved ones. It is essential to have a self-care plan and to stick to it as much as possible. The resource we are launching today has been developed by Dr. Jason Mills and aims to help healthcare workers create such a plan. Dr. Mills is a leading researcher in Australia in the area of self-care in palliative care practice. His peer-reviewed research is world-leading and his publications highly cited. This resource is the first of its kind in Australia to promote and support effective self-care practice in the palliative care sector. It's pleasing we've been able to launch this not only during Palliative Care Week, but during the 2020 year of the nurse and midwife. Palliative care workers have developed skills and resilience through their experience in dealing with issues related to death, terminal illness and bereavement on a regular basis. However, this can build a false sense of security, and without a plan, we can get easily depleted. Personally, I have found the need to roster self-care in the time for yoga, some gardening and spending time with family. Having a plan has been important for me to keep self-care at front of mind, especially when times get busy. I know that I will be using this resource and recommending it to my team. Before we start, I'll quickly go through some housekeeping. All participants will be muted during the webinar. However, we encourage you to comment and submit questions throughout. There is a Q&A icon and a chat icon just below me. The friendly PCA team are going to be monitoring these for the live Q&A session towards the second half of this event. Dr. Mills will first give an overview and explanation of the Self-Care Matters resource. Afterwards, he will have a how-to session with the PCA clinical advisor and frontline nurse practitioner, Kate Reed-Cox. Kate is a palliative care nurse practitioner at the Canberra Hospital and will give the participants a perspective on the resource. Finally, we will have time for the live Q&A session facilitated by PCA Senior Projects Officer Larissa Karpish. While we will endeavour to answer all your questions, due to the limited time, we'll make sure any unanswered questions are part of the FAQ section of the website in the coming week. I'm now delighted to introduce Dr. Jason Mills, who will give us an overview of the Self-Care Matters resource and demonstrate how to create a self-care plan. Thank you, and I hope you enjoy this webinar.
Thanks, Mira. Well, I'm very fortunate to have collaborated with Palliative Care Australia recently in developing the Self-Care Matters resource. And I'm truly delighted that such an important resource has received the full support of the team at Palliative Care Australia. You might well ask why self-care matters, and I'd say that's a great question, and one that this resource will help you explore to find your own answer that has personal meaning for you. But self-care isn't an endpoint or a checklist box that gets ticked. For me, self-care is a journey that began early in my clinical career and one that I've had to strengthen and refine over time, especially working in areas like palliative care or even now in roles as an educator and a researcher. There's a growing awareness that people can experience burnout, compassion fatigue, and moral distress. So for me, the need for self-care matters couldn't be any clearer. You can use this resource to sustain your compassionate care or use it to strengthen your resilience over time. or you could simply use it to be more proactive about your own health and well-being. So it's something that we can all benefit from. You don't have to be a health professional to use it. Self-Care Matters will step you through understanding self-care, planning for self-care, and practicing self-care. And when using it, you might find that actually self-care matters as more than you think. In it, you'll find key information and real-life insights from people working in palliative care. And one of the unique features of this resource is its practical tools to support self-compassion and self-care planning. And that's really quite helpful because the latest research tells us that these things are increasingly important and in need of practical support. So Self-Care Matters provides a systematic planning tool to help you to prioritise self-care, as well as some guided meditations for those wanting to have a taste of mindfulness or self-compassion. There's also a comprehensive list of external links relevant to self-care. So I'm really excited to be joining you today to talk about Self-Care Matters, and in particular, the process of developing a self-care plan. So it's time now to hear from someone who's recently been through this process. We're really lucky to have Kate online today. Hi, Kate, how are you going?
Hi, Jason. I'm great, thank you. And hello to everyone watching online.
Kate, just to begin with, could you just tell us a bit about your expertise in palliative care?
Yeah, absolutely. I'm a palliative care nurse practitioner and I've been working in that field for about 10 years, but nursing for over 20 now. I work both clinically at the Canberra Hospital, and I also work as the National Clinical Advisor for Palliative Care Australia. And above all that, I'm a mum. And so I have 5 kids, 4 at home between the ages of 10 and 18, and have quite a busy little life with them as well.
Thanks, Kate. We're really lucky to have you online and sharing your time and your insights with us. So today we're going to be talking about the self-care planning process. I guess I'm just interested to hear, before we go through it, what your thoughts are on having been through this planning process recently.
Self-care is something that people absolutely talk about at work, and we talk about clinical supervision, and I've always felt it was important, and I've always felt that it was part of something that we should be doing as a team. Can't say I've ever really internalized it too much to make it a practical outcome for me. So this was very new to me, to actually put pen to paper, to really think about what self-care means to me and what barriers there are as to why I haven't done it previously, and then what I might be able to do to achieve some of my personal goals, and thinking about what those were. Yeah, very new to me. So I initially found it a little bit confronting thinking about that, and then trying to work out how do I overcome particularly my feelings around self-care being almost a selfish, indulgent thing that I shouldn't be doing, which absolutely makes no sense when you think about the benefits of it for others, not just myself. So, but that is where it feels deep inside, I guess.
I guess I'm also curious, when you were approaching this, did you have any sense of, oh, I don't have time to do this? Because it's a common thing that I hear, and it's a very human thing that, oh, well, self-care sounds, I get it. I get it that it's important. I just don't have time.
Yeah, absolutely. So I did this. The actual practicalities of me doing it was at 6 o'clock on a Saturday morning before anyone else got up, so I could concentrate on it. So I made time, and I think that's what I wouldn't have normally done before, is to allow that to happen. But knowing that it was time to do something about my own self-care, and allowing myself that time to do it, and committing it on paper just makes it much more real, and might be something, and therefore something that I'm going to continue with.
Potentially one other barrier, which I guess it's it's similar to self-care, and I'm thinking about self-compassion. How did you come to, what were your thoughts on self-compassion?
Well, I hadn't really thought about self-compassion at all, and it was a new phrase to me. So I probably don't have a lot of self-compassion when it comes down to it. I have a lot of compassion for others, but I certainly don't really think about myself in that way. So I don't think when it comes to my emotional intelligence, when it comes to self-compassion, I don't think there's been a lot there, to be honest.
Well, look, again, I can relate to that. So, and look, the research that I've done here in Australia with palliative care nurses and doctors confirms exactly what you've just said, that by and large, we all have a lot of compassion for our patients and families and those people around us. Unfortunately, there's room for us to improve in terms of I guess also responding to our own needs and our own potential for suffering in the same way. And that's what self-compassion, it kind of involves self-kindness rather than beating yourself up. It involves just understanding that we are just like the rest of humanity, that, we have the same potential for suffering and that we are no less deserving of care or of meeting our own needs. So I guess if that helps, you're not alone, and it's something that I think many of us in this field can benefit from. Looking at the self-care planning process, and if you look at it, the first two steps of it really are very reflective and very much formative, or it's kind of about evaluating and getting a baseline of, okay, what does self-care look like for me at the moment, in terms of a baseline, or how do I even how do I relate to that concept of self-care? And you've already been telling me about that. So if you were to describe in a sense, what would your baseline be in terms of evaluating a current self-care practice?
So I think what really helped me do that was when I got up nice and early on Saturday morning to do that quietly without interruptions, was if you look at the resource on page 4 in particular, that the picture there of the pyramid, and really thinking about how the barriers and enablers to self-care practice have, what that means to me, and why I haven't actually done this before, why I've always sort of dismissed it when it's been talked about at work. So that's probably what got me started, and I was then able to move through the rest of the resource with identifying what those things were and how that meant in my world, so that I could then get to the bottom of the pyramid.
So Kate, I guess moving on to the next step of the self-care planning process, and it involves reflecting on your personal values and maybe what your motivation is or might be for really putting self-care into practice. Can you tell me a little bit about that for you?
I divided my personal life and my work life as two separate parts when I was looking at this question, because they are very different. I think that my work persona is quite different to my family persona. So what I really value with my family is time with them, which there's not always a lot of that. Caring for my family is a huge part, and surprisingly enough, I was surprised that my meal preparation was actually really quite important to me. Not when I'm being forced to, but when I'm more enjoying it. And also going to all the sports things, the trainings, the games, and having one-on-one time with each of them, because quite a big family, including with my husband, and sitting around watching a movie together. These are the things that are pretty important to me. They're small, but they're very important. My work life is really the strong thing for me is connecting with my patients and seeing their care through, also reducing suffering as quickly as possible. and I know this is a bit more technical, but dropping their like symptom scores by about 3 points or more, I feel that I've met a goal when we talk about the agreed goals with a patient, and looking at their goals of care and meeting those. So by doing that, I guess that's a huge part of why I can continue to do the work that I do with patients. And keeping those positive relationships with my colleagues and helping them meet their goals and having a laugh with them, that, socializing with them is a massive part of my work life and what's important to me there.
I'm interested to hear what your thoughts were in approaching this concept of work-life harmony, and how you were able to connect with that, or whether it resonated.
The concept of work-life harmony was relatively new to me. I've certainly know work-life balance, and I've always thought that was something that I'll attain down the track because it seems too far away, because there's a lot of mum guilt with me being at work and not with them, and then I'm at home and I'm not at work. And now with COVID-19, we've got the added bonus of homeschooling, and that has really rocked my work-life balance, how harmony, and there really isn't harmony at the moment. So I do feel that it is something that I absolutely want, but it's not necessarily something that I have, even though I've tried to maybe in times reduce hours or look at different jobs that are more flexible arrangements, done things like that, but just really not got there in the end. And I'm wondering, after going through this process, if a lot of that's to do with what's going on inside of me rather than what's going on around me.
I was really fascinated to speak with lots of people who said they had a visceral reaction to the notion of work-life balance. And, either they said that it's a myth, there's no such thing, or, something to that effect. And it made me really begin to think that, okay, well, work-life balance can be a helpful concept for people, and maybe for people who are better able to quantify in terms of, hours. How many hours do I spend at work versus how many hours do I spend at home or with my family or on holidays? But for other people, I guess work-life harmony might be a more qualitative sense of how am I feeling at the moment in terms of, how am I traveling with work and personal life outside of work? Do I feel that I'm in a good place? Do I feel that there's a nice, is it working for me right now? And it seems that people might be able to better relate to that rather than a quantifying kind of work-life balance. What's most important for your self-care is that you practice it across the 3 domains of self-care that make life meaningful and sustainable for you.
Mm-hmm.
So I guess could we first just touch on, your thoughts in approaching, reflecting on the different stresses or stressors in your life, whether they're, not just limited to work, but there are stresses outside of work. So can you tell me a little bit about that?
Yeah. So I did when I looked at this, I was thinking mainly about work, to be honest, because that's where a lot of my frustration comes down to. Just looking at when you can't meet patients' agreed outcomes because of things that happen that are completely outside of your control, and being able to work with that patient, but finding that there's constantly things that are coming in that don't necessarily focus on the patient, but on them holistically, because the approach in palliative care, as you know, it's very different to in the acute hospital in particular, that other people have different goals for the patient and not necessarily with the patient. With my other role here at Palliative Care Australia, I guess there has a bit more flexibility. I'm able to work from home, but there's a lot of times when you're juggling different things, and there's all the balls seem to be up in the air, and then your family comes along too, and you just feel like, wow, that's all going to come crashing down around me. And also, as a nurse practitioner, one of the things that we talk about a lot in the role is looking at what comes next, what the career aspirations and pathways, because I still want to advance my career, and what does that look like? How do we get there? And so there's a lot of things that go through with workplace stresses. Family wise, it's mainly the juggle of trying to always feel like you're able to meet everyone's needs and not be those needs change, and who needs you the most at one point and who needs you the most the next day. And like I was saying before to a friend, that I've got quite good at year 7 algebra now, second time round. Those things, they've become we just have to be so flexible and be able to move really well with what's going on. But though all of those things are great while they're happening, it's in the quiet moments that I think I question everything that I'm doing. I question whether or not I'm doing the right thing, whether I'm achieving enough, whether I'm meeting my goals, whether I'm done the right thing by this person or that person. The self-talk that goes on in the quiet moments can be very difficult. Putting pen to paper always helps, and it made me recognize them and list them, which I hadn't done previously. So it just by doing that, I was able to actually speak to my husband Nick and about it as well, and said and him to have a bit more of an understanding of what goes on behind the scenes that he doesn't see, because he thinks completely differently to how I do. And it's really good to give some sort of understanding of what each other are finding. So he did a little bit of this too, thanks to me going through it.
Why not?
Yeah,
absolutely. I guess briefly, so how did you find the idea of setting goals for self-care?
Yeah, so I set goals. I looked at the daily goals, and those were incorporating the running that I'm already doing, and then looking at that 10 minutes of quiet time in an evening. Weekly, certainly seeing friends and soccer game, because I do play soccer. When we're out of isolation, we're back to playing soccer and training. And monthly, I looked at having a date night with my husband and one-on-one time with each of the children. And yearly, looking at a holiday, getting out on our boat, getting out on the water. We love doing that, but we don't really able to do that very often because we don't commit to it. Getting to the coast, maybe even a weekend away with my husband might be something in the actual future. And spending some time, a weekend away with my girlfriends as well would be great. So, I was able to set that down, and it's something that I'm going to share with the family too.
So I guess when you're thinking about achieving these goals, what kind of things did you think about in terms of your self-efficacy, and I guess any supports that you might benefit from in terms of achieving those goals?
On a personal level, I think that I need my family to understand that they have to realise there's a priority for me to look after myself, so I can be a better mum, a better wife, that's a much more sustainable way for all of us as a family. And that's really hard to get kids around to, but at least by me doing it as well, it will show them that they can do it too, and that by leading them, and they might find that when they're in these sorts of positions or this sort of role, that they too can be able to give themselves the space to care for themselves. When it comes to work, I guess I need my work life to understand, or my managers to understand that I need to draw the line occasionally and support me to do so. I'm not very good at saying no. In fact, I'm pretty horrendous at it. And that time does not necessarily equal effort, and that by being me, I mean, I can happily stuff an 8-hour day into 4 to 6 hours some days and think, oh my gosh. So being able to work more efficiently, or more like smarter, not harder, and having the supports to do that, I think are really important, particularly in health roles, in nursing or medical roles. And being able also to participate in your continuous professional development. We got these kind of roles, or got here, because we do like to drive ourselves professionally, and we like to be able to achieve things. And so continuing that, if that was to stop, or that wasn't supported, then you wouldn't get satisfaction from the job.
So I guess the next step of the self-care planning process is about committing to take action. So I'm really curious, did you decide to go on and develop a self-care plan?
I did, but I did it the next day, funnily enough. So I wrote down all the things that I did, and then so I did that on the Saturday morning, and then I got up early on the Sunday morning and did it, and finished and did my self-care plan. And a big part of that is is recognizing I need to show my family the self-care plan so that they understand what I'm doing. And so we've started, I did do that as well. So I've have made some changes. When I completed the thoughts and feelings and drivers for my self-care plan, I was then looking at my motivations as per the PDF and following that. And really, it did help actually having a bit of a break from it, and then coming back the next day and looking at it again. And I have reflected that the care for myself, and recognized that I don't necessarily have the resources to help me maintain my energy and balance in my life for a harmonized way, because that we can pretty much all agree to that I wasn't doing anything too much before to provide harmonization. And I want to be able to lead my work at work, and I also want to be present for my family. So those are huge motivators, and I want to build that personal capacity for resilience and helping reduce the risk of burnout, that it doesn't happen again, that I can continue my career and finish out my career as successfully as possible. That I also need to say no more often, and that consistently comes up with my management. But one of the things that struck me with when I was doing this is that I could use this in my annual development plan. I could take it to my manager and I could say, look, here is what I'm doing for myself to help improve me as an employee, to give more to the job, to be here more, like more resilient, so more sustainable. And it also meets standard 9 of that National Palliative Care standards, and for PACSA. So if you're doing your palliative care assessment as a workplace and you have your team involved in self-care, these are real and tangible resources that we can use to help build team resilience. And that, I think, for someone who isn't very good at being able to do things for myself, that I can do stuff for my team and have the added side effect or benefit for doing this for myself. And so therefore I think that it's actually sustainable for me, not as a long-term plan.
That's a really great point, Kate, because self-care, I guess in any context of life, there are certain things that we can only control certain things. And, we can do our bit by engaging with self-care at work and outside of work. But, the point that you make is a really good one about palliative care services and workplaces, that particularly standard 9, that, staff support is really explicit in that standard. And, this tool is certainly something that they could use to help support staff in terms of their self-care and their self-care planning. So having gone through all of the reflection and the jotting down of all of your thoughts and your ideas and looking at the different stresses that you're managing How does it feel now having actually developed a self-care plan?
I feel positive about it. I do feel that I've built a self-care plan that is doable. It's not too huge, but I could maintain it. And I do feel that it's a tangible thing that I can use for my own personal growth and professional growth.
Well, that's great, Kate. I know there are lots of people who've joined us online. So how about we actually open up the discussion and we hear from those people?
Yeah, that sounds good, Jace. So if anyone's got any burning questions out there, let's go to some Q&A.
Thank you, Jason and Kate. Hello, everyone. It's Larissa here from PCA. We've had some fantastic questions coming in, and many of you have noted the honesty with which Kate has spoken about her own self-care and her self-care planning. I'll do my best to cover the questions that we've been receiving today. We're going to kick off with one that was pre-submitted during registration, and we'll direct that question to Jason. The question is, how can we best cope in a team where a culture of busyness is esteemed? For example, where the focus is on the number of patients being seen, which often can lead to burnout. Jason.
Thanks, Larissa. That's a very, very topical question and an important one. It's good to see that obviously this person asking this question is reflecting on that and currently experiencing that challenge. I think the notion of busyness and being time poor is certainly something that I think we can all relate to. And I think in this COVID, post-COVID or currently the pandemic situation that we're in, particularly with palliative care in terms of the restrictions that you mentioned in terms of the social distancing and even I think, with funerals, the limitations on how many people can attend funerals. I think there's a real risk for moral distress, and this is something that was alluded to earlier. And, by mentioning this, it's by no means am I meaning to sound alarmist, but it's something that's a very real risk. And I think for self-care, self-awareness is a really fundamental enabler to self-care. It's really difficult to care for your own needs if your level of self-awareness is not as good as it could be. So I think the first one is in terms of, checking in with yourself to raise that self-awareness. I think self-acceptance and self-compassion also follow. And I know that I'm conscious that that's probably 3 words that I've used that begin with self. But the thing is that I think it helps to be aware of your values, because they, in a sense, our values are our moral compass, and they're very central to our identity, whether that's our professional identity or our personal. So I think checking in with yourself and really, I guess, processing and asking yourself, where am I at and what is it about this situation that's really unsettling for me? And I think Kate alluded to this really nicely earlier, is that sometimes there are external situations, our surroundings, our environment, that we can't control. There are certain things often that we can't control. And so we have no choice then but to look at internally at what is it that we can control in our sphere of influence. And I think by, tapping into that self-awareness in the context of self-care, really being clear about what your values are and what it is about the situation that is perhaps making you feel incongruent in terms of your values. So that's an individual kind of perspective. And individually, there are things like compassion meditation that can actually help in this area where physically you may have limitations in what you can do, but there are some kind of meditations generating compassion for others and also for yourself, because from what I hear, there's suffering being experienced by both parties in this. So, and then collectively, I think, connect with your peers it's quite likely that you're not alone in this, that people in your team are perhaps experiencing the same thing. So some people find journaling really helpful, or some other kind of activity, whether it's physical or meditative or some kind of hobby, to help also give some perspective, so that this one part of your life doesn't necessarily become global and, I guess, become all consuming.
Thank you, Jason. I might throw the next question to Kate. Jane from Bendigo asks, how do we look after our emotional and mental health with the additional burden that nurses carry with COVID? For example, the hard task of implementing visitor restrictions. Kate.
Thank you. I can certainly sympathise with that. We've had some very difficult times with the visitor restrictions ourselves, and I know that that's broadly speaks for everyone across Australia, and probably even more so for, I know that there's some people from overseas who have come into this chat today as well. I think the stresses that are being put on us right now, we know that it is going to end. There is an end in sight. We're hoping that it's going to come sooner rather than later. But really making sure that we're able to speak our truth to our managers or to the wards, to be able to talk about our patients and advocate for them, even if we can't change what's happening. In palliative care, our responsibility is to look at being compassionate to our patients and advocating for them in that way. I was recently in a situation where we couldn't have two visitors come in to see a patient who was not actively dying but heading towards end of life, and the wife was not allowed to come in because she had a baby with her, and that was considered to be two people. Now that just came down to the matter that the person at the door was not educated well enough about what was happening, and things have been put into place really, really fast. And so everyone was playing catch up to the visitor restrictions. And I think we were able to get teams to talk more. We were able to talk to the managers and do some stuff really fast as well to make sure that people with palliative care needs, or those who needed more support, who were in the hospitals, were able to be seen by their loved ones. The stress on the staff is there. It's absolutely there. And I think that's where we really need the senior members of the teams to step up and provide that support for the other members of the team as well, and to make sure that the conversation is continually there, that we're all talking about this. We know that we're all feeling it, so there's nothing hidden. We need to be very clear that none of us are going to get through this completely unscathed, but to protect our mental health, to protect our emotional health, and therefore our resilience and sustainability going forward, we need to care for not only ourselves, but that self-care for each other.
Wonderful. Thank you, Kate. And there are many questions coming in. It's fantastic to see. Thank you, everyone, for your questions. This next one comes from Dr. Chi Lee, and I'll direct it to Jason. The question is, I know you've been doing some research looking at self-care practices amongst palliative care clinicians. I'd love to hear about any findings that may have surprised, delighted, or possibly worried you. Jason.
Thanks for the question, Chi. Perhaps all of the above: surprised, delighted, and I'm sorry I missed the other one. Look, off the top of my head, not being put on the spot at all, Chi. Look, there were a couple of things that stood out for me, and just building off what Kate just alluded to. I was really interested to hear, some quite disparate positions that people found themselves in, and I think they really point to the need and the importance of compassionate leadership and role modelling self-care. So what delighted me was hearing from people, team leaders or nurse unit managers in a hospice who really understood the importance of self-care and said, look, as a leader, I see it as part of my responsibility to set the culture and set the example as a role model. So my team, the staff in my team don't feel that, I guess, so that they don't need to feel that they need permission to engage with self-care, that it's actually a cultural norm and that it's valued, and the importance of it is valued in the contribution it makes to quality care for patients. So that really delighted me. Something that was a little more disappointing on the flip side was the opposite, where there were some members of a team who understood the importance of self-care and perhaps had felt the impact of not practicing self-care, that they were burnt out. But they found themselves in a team where it was a real struggle to practice self-care, they felt that to do it, they really had to go against the grain in terms of that culture. So I think that's a challenge. It's a very real challenge that many people face. Finally, I think one that points to a real need and benefit that the Self-Care Matters resource offers is everyone in my study who used a self-care plan, 100% of people swore by it. They said it was an absolutely effective self-care strategy. So, hearing that was positive. What was interesting is that of the people, the larger majority of people who didn't use a self-care plan, and many hadn't even, heard of or thought of the idea of developing a self-care plan, most of those, nearly all of those people said, actually, I'd be really interested in this idea of developing a self-care plan, but I just wouldn't know where to start. I would need some support, some guidance in terms of doing that. So that's something that the Self-Care Matters resource really provides.
Thanks, Jason. Might throw this one to you, Jason, but then also to Kate. The question comes from Mark Waters. We're so good at defining ourselves in a work role or by our family role, but how do we cut through that to be able to value ourselves more as ourselves? Jason, I might ask you to talk to that for a couple of minutes, and then if you could flick to Kate before our next question.
Thank you for the question. I think there's a profound, that's quite a profound question. And, we do wear hats. We have various social roles and professional roles. And I think you're quite right. Sometimes we can become, or those roles and the hats we wear can become all engrossing. I'm sorry to say, I don't think I have the answer for you. I don't think it's a prescriptive kind of thing that, there's a magic formula, but I think self-care is a journey, and I think it's a process of reflection, because we as individuals are constantly evolving in our environments that are changing, and all of this in relation to those around us, whether it's our personal social networks or our colleagues at work. So I think the closest I can get to pointing into the direction is, I think ultimately this is about how we relate to ourselves and how we understand ourselves. And I'm not sure that I can say too much more than that, other than I think it's a very personal kind of journey, and one that I think is very, there's a lot of merit in traveling that journey.
I'm happy to build a little bit on what Jason was saying, because I feel the same way, that it's a big question. Certainly when we are in our different roles, having insight into what motivates you and what keeps you there and what keeps you turning up and being present and being a positive add to the situation, I think is a huge part of getting that feedback to yourself so that you can do it again the next day. So having insight into the roles that you play within your workplaces, within your homes, within your friendships, is a massive part of how we are able to move forward and to provide ourselves with that self-care.
Thank you, Kate. Thank you, Jason. We have another question, and perhaps this time we'll kick off with you, Kate. My concern, it comes from Tricia Lee. Thank you, Tricia. Is for family carers at end of life and how we support them to practice self-care. Guilt is a huge issue. And I think, Kate, you touched on mum guilt, for example, but all sorts of guilt. And it would be good to know if Palliative Care Australia has a plan for this to roll out to home hospice providers. What would you be able to tell us there, Kate?
So when we're talking about home hospice providers and we're talking about care, I'm going to assume that we mean by that like the family and carers of the person who is dying. And hopefully I've got that right. So providing them with the tools for self-care. Thankfully, I guess with when you have access to a multidisciplinary team in palliative care, that you can use those wonderful people within your team to help balance some of those psychosocial issues and address those with families. And that might be because as I've always said about families, there's no such thing as a normal family. You just haven't asked the right question yet. And you'll find that there's something that you need to unpack or something that needs to be addressed. And these are raw emotions when someone is particularly when they're actively dying and families are coming together. So when I like to talk to patients and their families about what it is that they enjoy, what they do normally. I will often say to like the next of kin, or like particularly if let's say an elderly gentleman's dying, I say to his wife and to the daughter, make sure that you've got a general practitioner appointment booked in for your mum in a couple of weeks' time, so that there's check-ins and giving them permission, though, also to say, no, you can get out for a walk if you want to. Speak to a family friend, speak to someone who you trust, who can come in and you can go out for a walk for an hour. You can do that. Giving them permission to be able to care for themselves from us as professionals is a huge way of being able to allow them to do what they need to do and to keep them healthy in a situation that is absolutely stressful and absolutely exhausted. And we all know that when someone is dying, and particularly when they're at home, the family are immersed in that, and then the person dies, and then they have to organise, well, not necessarily a large funeral at the moment, but organise a funeral within a short time frame, and there's all these demands on them. They're feeling like they've got to be able to answer questions for this family member and be able to be available for that family member and all this stuff, and they want to make questioning what they're doing. So giving them permission and normalising their feelings in that situation, it would be a great way to start. PCA has definitely looked at and done resources for carers. There's been some significant work done in paediatrics around that, and there is resources available on the website. So you can have a look and see what you can find. But I think we are recording all of this, and so we'll take that on board as well. So thank you.
Thank you, Kate. And of course, the Self-Care Matters resource is available on our website for everybody. And whilst we have had the privilege of working so closely with Jason and seeing your honesty today, Kate, as a frontline palliative care nurse, anyone who might be interested in planning for and understanding self-care and practicing it is very welcome to use those resources, whether it's home hospice providers or even more generally across life and community settings. The next question I have for you is a question from Jennifer Smith, and I might throw it to Jason to comment on to begin with. The question is that the honesty that's been shared here today is very much self-caring. It seems to involve doing things that we see as self-caring. Do we need to reframe self-care though, so it's seen as and known as more than things to do, and more how am I, and how am I in all I do? Jason.
Yes, I'm not sure that I can answer with just yes, but yes. I think it's very helpful to, I guess, understand the core of what it means. And I think that's why, we heard Kate discussing earlier, I think right at the beginning, and the tool, the planning tool really prompts you to be quite introspective and ask, what does self-care mean to me? What does it look like? What do I want it to look like? And although there are strategies and activities that that you are prompted to identify, I think underneath all of that, it is really about an underpinning philosophy in terms of how you relate to yourself in relation to others, and your health and well-being as a kind of conduit in between that. So I take the point, and it's something that I mentioned a little bit earlier, that in the evolution of it's still very much a work in progress. Self-care for me, I'm not sure that I've met anyone who's ticked that box and mastered it. And that's the exact point I think you're making, Jen, is that self-care isn't about a checklist necessarily. It's a lot more than that. And it's a way of being. If I remember, one of the things that you taught me, Jen, was exactly that it is a way of being, and it's something that we embody. I'm referring to when I was doing my research, and I can't help but agree with you that it is more than a checklist. However, I think for some people, scaffolding, for many of us, the idea of self-care is foreign, and actually trying to put it into practice may be really quite challenging. Because Paul Gilbert in the UK has established, quite clearly that there are fears of compassion and fears of self-compassion. And this can help to explain why sometimes we may feel a little bit of internal resistance around, it feels a little bit strange to think about being kind to myself and, caring for myself. So I think in some ways, some people may find starting with a dot point list may be helpful for them. So I'm not saying that you shouldn't use a checklist, but absolutely agree that it is absolutely much more than a to-do list.
Thank you, Jason. It's interesting that you point out that there is a lot more than you think when it comes to self-care, but in fact, Kate, I'm going to throw to you. This is the last question before we go back to Mira to conclude today's virtual event, which we hope you have all enjoyed. And we're looking forward to Mira's concluding comments. But this one for you, Kate, from Sue Morton. How do I make a start with self-care? And Kate, you touched a little on this when you said that putting pen to paper helped you to get started. Kate.
Thank you, Larissa. Absolutely. Starting was has always been hard to prioritize that space so you can do the self-care work. But now that the resource is there to guide you through it, it's a real prompter. And I think having this conversation today with so many of you out there as well, that it's time to think about what you can do in the next few days or weeks, where you can sit down and take that time out and look at it and just put pen to paper. And once you start, you can make those commitments to yourself that you deserve, to be able to find what you need for self-care that will be able to sustain you throughout with your life and your career. The two don't coexist without some work. We have to do the work from within ourselves to do that.
Jason, very quickly, is there anything else you'd like to add to that before we conclude today's event with Mira, our chair?
I would say what Kate said. Absolutely agree. I'm not sure that I could add more to that.
Well, Jason and Kate, it's been wonderful to have you along, and we absolutely thank so many people for taking an interest in self-care and participating in today's Q&A session, for all the interesting questions. Apologies we couldn't get to them all. We really thank you. We will be attempting to answer all questions received today and more in an FAQ webpage that we will publish to our website alongside the Self-Care Matters resource. Of course, you can follow us on Facebook and Twitter, where we will also be keeping you all updated. And of course, we wish you all the best with your own understanding, planning for, and practicing of self-care, because self-care matters. Now I'd like to invite PCA Board Chair, Professor Mira Agar, back to conclude today's Self-Care Matters launch event. Thank you, Mira.
Thank you very much for your questions and comments. This is all we have time for today, but you can send any additional questions you have to pca@palliativecare.org.au. Please join me in thanking Dr. Mills and Kate Reed-Cox for showing us just how easy it is to develop your own self-care plan. Thank you to Larissa for navigating the question and answer sessions for us. Again, I strongly encourage you to visit the Palliative Care Australia website and download the Self-Care Matters resources. Just takes a few minutes to build a plan that could help you for the rest of your life. Following this webinar, you will also be asked to answer a quick survey. This will really assist us in the Palliative Care Australia office planning future resources and events. Thank you and have a wonderful day.